We are back on Morning Line. Thanks for joining us this morning. Clint Kelly with us, malpractice attorney, taking your phone calls. If you want to join in the conversation, we'll get the number up there. We have some folks that waited through the break. So questions. Let's find out if you have a case. We'll start off with Carolyn. Carolyn, good morning.
Good morning.
Hi, Carolyn. How can we help you?
Well, my husband had a prostate biopsy a year and a half ago, and since he had that biopsy, he has been experiencing blood in his urine and his semen off and on. It hasn't been constant. They'll give him antibiotics, it'll go away, then it'll come right back. Is there any way we can find out if that was something the doctor did wrong?
Yes, it sounds like, first of all, you got to determine what went wrong, and that's going to involve having another doctor, presumably another doctor, taking a look at him and try to find out what's causing, it's called hematuria, blood in the urine, what's causing that situation. And then once you figure out what the cause is, then you can determine whether it's the product of negligence or simply a risk of the procedure that he had, a prostate biopsy. That may well be a risk, and if it is, doesn't mean it's right, but it may just simply be a complication that's known, and you'll have to determine from another doctor what's causing the problem.
And since it's a year and a half, this is one maybe statute of limitations if she had a case would come in, or is it something because it was a condition that maybe has continued and finally came to their attention could... what do you think, if there was something that was actionable?
The question here is, he had the procedure a year and a half ago. Was the hematuria, the blood in the urine, something that happened very soon afterwards? Would a reasonable person under those circumstances go get checked and believe that something went wrong?
Yeah.
So the statute of limitations could be an issue here in this case.
All right. And so have you gotten a second opinion?
Other doctors, and they don't seem to want to pursue it.
Well, so they say that it's something that just happens with this type of surgery sometimes?
Well, they said it's unusual for it to keep going for a year and a half. I mean, we knew it was going to happen for a short period of time after the thing, but it just keeps coming back.
Okay, so but have you asked them, said, all right, so it's unusual, can we fix it? And what do the other doctors say? I mean, they can't help you?
Give them antibiotics.
Oh, just antibiotics. So they think it's stemming from an infection as opposed to maybe something leaking, or I don't know.
That's a tough situation, and if she's been or he's been to other doctors and they're hesitant to do anything about it, it may be a situation where someone's having difficulty treating it. And that raises a whole host of issues that's outside my realm of expertise.
Okay. How often will doctors sometimes be willing to, say another doctor made a mistake or something along those lines? Does that happen?
It does happen. Actually, it happens quite a bit, Nick. You'd be surprised how many of them will tell the patient that another doctor screwed up.
Okay.
They'll use a different phrase, but then when you put that doctor on the witness stand under the bright, hot white lights, all of a sudden it becomes much more watered down.
Okay.
And most of the time they will not testify against another doctor.
They will?
Will not.
Will not. And so you have several doctors sometimes for certain types of cases that you have relationships with that will look at cases and tell you honestly whether they think there was a standard of care violation or not.
Correct. That's where my skill comes into play, because I have a number of expert witnesses available to me to review a case who will testify if the case has merit.
Yeah, and you have sometimes they'll look at it and say, well, Clint, I see what you're after here, but really the standard of care was followed. And
bad outcome.
Bad outcome, and that sometimes is the case. Carolyn, I would just say all we can offer from you on this point is, continue to seek, medical care for your husband to get it corrected, but that's a tricky one.
It is.
That's a tricky one. Let's go to Randy. Randy, good morning.
Okay, I got a question for you.
Sure.
Okay, last month I had called an ambulance on my mom because she was possibly having a stroke. And they something alarmed the EMTs. And by the time I got to the hospital, they done had my mom on a ventilator. She eventually got transferred to another hospital because they found out she had an acute brain bleed. And that basically went away after about a week. And she also had respiratory issues. A doctor eventually came in and needed to get a hold of my grandmother because my grandmother was the primary contact. He convinced my grandmother to pull the plug on my mother. Can he legally do that?
Who's he who pulled the plug?
It and he said he was my mom's primary. It was one doctor that was that said that he was overseeing my mom's case. I've never seen him.
All right, Randy. The question of his authority to do that depends on whether she executed what's called a do not resuscitate order.
And my mom did actually have an advanced care plan that says she did not want to live off any on a ventilator long term.
Okay.
Right. It sounds to me like she had given prior authority for him to do this, and you'll read these, a lot of times they'll have phrases in there like do not resuscitate or no heroic measures or no persistent care like this because no one wants to live like a vegetable. I mean,
Right.
and that's why these agreements are important, and so it sounds to me like the doctor had that authority.
Okay, yeah, if there was that document and it's legal, then that's something, yeah. If indeed he had that and he confirmed it, that's probably the
Now,
case,
Nick,
Randy.
that doesn't mean that Randy doesn't have a case. If there's a case involved in it, it just simply means that the doctor had the authority to pull the plug. There may have been some negligence here, and it could be a case if there was something proven there, but the doctor's complying with the law by doing this if he has a do not resuscitate order.
All right, let's go to Joe. Joe, good morning.
Good morning, Nick.
Hi, Joe.
Just a couple of comments real quick. I want to appreciate having Mr. Kelly on to give this expert advice he's giving out to people. People should listen to him because he's telling them what they need to do. Just a brief, I had an arteriogram been a couple of years, 3 years ago now, but while I was doing the arteriogram, the nurses and the doctor were joking around. I mean, when you have an arteriogram, you're not all the way out, so you can hear. And they were telling about their trip to Florida, and how they had to put tires on their car. And, you know, to me, that's kind of unprofessional. I think these people, doctors and nurses, do this stuff so much, they just kind of take it lightly. So sometimes, you know, I don't like that to hear people joking around when they're doing
Right.
an arteriogram on me. So that kind of goes back to what happened out there in Las Vegas. So sometimes you know, these people just are not taking a lot of this stuff serious, and they should be, because when you're fooling around with your heart and your arteriogram procedures and stuff, that's not no joking matter.
No.
That's what I got to say.
Hey, thank you, Joe. I mean, that's, yeah, what do you think of that?
Well, I want to talk about what Joe's saying because it's important. You know, we have discussed before the fact that, in my opinion, it's just my professional opinion, one of the reasons that we're having more and more malpractice cases, the reason why the healthcare system is producing these types of cases, is that the hospitals and the doctors are trying to shove more and more procedures into a tighter window of time. Okay? They can't spend as much time with patients as they used to. I think the inevitable product of that is two things. First of all, the margin of safety shrinks, so there's going to be more errors. And secondly, I think there is a mentality where they treat patients like cattle.
Because they're rolling them in so fast?
Exactly. And so, you know, when Joe's having his arteriogram, are they thinking about Joe, or are they thinking about their trip to Florida and Joe's just another number? He's just another piece of flesh sitting on the table. That's concerning, because it's you want the doctor and the nurse focused directly on what they're doing, not about what they did in Florida. And so I think that this is something that's, what Joe mentioned, is more symptomatic of the problems that we're having right now, and we're going to continue to have as corporations, the ones that own the hospitals and the clinics, try to keep their income up.
So it's greed money.
By forcing more and more
Yeah.
procedures into a tighter window. And you'll have, believe me, nurses, respiratory therapists, doctors will admit that's what's going on right now.
I guess I want to take a break. When we come back, we'll take more calls. The lines are open if you want to jump in. But I want to get more into just where that line is. I know when I went in to have my colonoscopy, I was joking around with the doctors beforehand. And I had a Greek doctor, which was kind of cool because I'm Greek. And he puts on this Greek music. And we're listening to this bouzouki music and Zorba the Greek. And that, as I'm going to sleep, I mean, actually, that relaxed me. I had no problem with that at all. And what's the line? Joe was kind of in a fog, but hearing him talk about their trip to Florida or whatever, where's the professionalism? What's okay, what's not? I know a lot of doctors during surgery do listen to music to calm and help them focus. So we'll get into that, and then also have a question. I have a lot of friends that are nurses, and they're playing doctor.
Yes.
We'll take a break.
Yes.
Be back with more of your calls, 737-7587. Lines open if you have a question about a malpractice, possibly. Our attorney will answer right after this. Stay with us.